Okay, so what are Bell's palsy? So you can see that forehead of the area is left free. It is not paralyzed. When we ask the patient to frown, you can see nice horizontal wrinkles. So upper head is left off. Only the lower part of the face is paralyzed. Then you know that this is an upper motor neuron injury. Okay. So upper motor neuron injury, only lower half of the face is paralyzed, not both the side or not entire half of the face. Why not entire half of the face? Because forehead is represented by both sides of the brain. Both sides of the brain, both sides of the neurons are supplying the forehead on all both sides. So that's why you will have this area left. Okay, it is not paralyzed. Okay, in upper motor neuron paralysis. In lower motor neuron paralysis, the entire face is paralyzed. So what happens is, you know that yes, this is an ipsilateral paralysis, lower motor neuron injury. Okay, everyone here with me? Clear? Did you understand Bell's palsy?
Yes, ma'am.
Yes,
Yes.
ma'am.
So you should be able to write what is Bell's palsy, what is upper motor neuron paralysis, what is lower motor neuron paralysis, how to identify how a patient is coming in front of you, what is a presentation, typical presentation of Bell's palsy. Okay. See here, you can see that this is a typical lower motor neuron paralysis. Okay, sorry, upper motor neuron paralysis. Lower half of the face is paralyzed. When you ask the patient to open the mouth and constrict, see here, only one side is going upwards, the other side is not going upwards. Okay, this is a lower part of the face is paralyzed. Okay, clear till here, everyone? Okay,
Yes, ma'am.
so here,
Yes.
try to see the video. Presenting complaint. This is how we usually do that. Okay, history taking. What is a, see the paralysis? Can you see that? All of you clear with this?
Yes, ma'am.
Once again, I'll show you that forehead. Can you see that? No
Yes, ma'am.
horizontal wrinkles. When you ask the patient to close, one side of the eye closes, the other side doesn't close well. Blow, buccinator, one side is. So you can see this video. I'm not sure, I cannot provide you video of Bell's palsy. You can get it from YouTube. You can try to find out good case studies on Bell's palsy. You can have a look at it, but I'll give you this PowerPoint presentation later on. This is treatment and all not required for you. Examination. How do you examine facial nerve paralysis? You ask the patient to do this. Okay. So that's all. I want you to see the blood supply very quickly. We will just go through idea. I don't have enough time for blood supply, but I'll try to show you. Can you all see the presentation? See this?
Yes, ma'am.
Right.
Yes, ma'am.
Yes, ma'am.
Okay. Now see here. This is the neck dissection. Okay. This is the neck region. We have dissected neck. This is the anterior triangle. Here you can see a major vessel. This is the common carotid artery. Common carotid artery divides into external carotid and internal carotid. Internal carotid goes into the cranial cavity. This is external carotid. Okay, external carotid supplies the outside of the cranial cavity. That's why it is called as external carotid. So this external carotid gives branches. What type of branches? See here, this is once again the same dissection. You are having a closer look of carotid. This is a common carotid. This is the external carotid. This is internal carotid. Okay, we are seeing dissection pictures. So this is the external carotid. External carotid gives off a lot of branches, thyroid, lingual. But here I would like you to concentrate on this particular artery. Okay, this is the facial artery. Okay, facial artery. Can you all see this? This is the facial artery. Now facial artery has got a lot of pores. What pores? Pores in the neck, pores in the face. Right now, in the face only we are discussing. We are not studying the pores of facial artery in the neck. Please remember that. In the face only we are studying. Okay? So from where it originates? It is originating from the external carotid artery. At which level? At the level of, you will not understand right now, this is a hyoid bone at the tip of greater cornu-of-hyoid bone. This, at this region it is starting. It gives off a curved S-shaped course around the submandibular gland. Okay, in dissection hall you will see the submandibular gland. In close relation to that you will see this external carotid artery and its branches, that is a facial nerve. Then what is important for us at the face level? It is coming at the antero-inferior angle of the masseter. Where is antero-inferior angle of the masseter? On the side of your face. Can you all see me? Can you all see me, my video?
Yes, ma'am.
Right. All of you look at this video on the side in front of the ear, this region. When you clench your teeth, this is called as clenching of your teeth. Okay, closing the teeth. Keep your hand on the side, clench your teeth. Okay, there is a bulge here. There is a muscle bulging here. That is called as masseter. Okay, at the anterior and inferior angle of the masseter on the jaw. Okay, this is the jaw. On the jaw, antero-inferior angle of the masseter, keep your three fingers, these three fingers, middle three fingers, at the antero-inferior angle of the masseter, compress against the jawbone, mandible. You can feel the facial artery pulse. Okay, you have to clench your teeth. Masseter will bulge at the antero-inferior angle of the masseter. You all have to feel this pulse. In exam also we might ask you to feel the pulse of the facial artery. This facial artery is also called as anesthetist artery. Why? Anesthetist is always sitting at the head end of the person during giving anesthesia during surgeries. What they do, they can't come front and feel the pulse. So what they do, they feel the pulse from here, okay, at the face of the patient. That's why facial artery is also called as anesthetist artery. In Viva, we will ask you which structure is called as anesthetist artery. That is the facial artery. Where will you feel the pulse of the facial artery? At the antero-inferior angle of the masseter. Here we have removed that masseter muscle. I have a picture of facial artery. I'll try to show you that facial artery. These are triangles. Okay, that's it. I think face ka at the end. Yes. Yes. Now see here, this is the masseter muscle. We have reflected that masseter muscle. We can see at the antero-inferior angle of the masseter, we have facial artery. This is the parotid gland, parotid duct on the masseter muscle. Okay, I'll show you all these pictures later also. We don't have time for that. These are the nerves emerging out of the parotid gland. Yesterday we had seen this typical presentation. Nice presentation of the facial branches. We had seen that. And have a look at facial artery now. This is a facial artery. First feature, what you can observe is this is the facial vein, this is the facial artery. See the difference between facial artery and vein. Facial vein is straight, facial artery is tortuous. Tortuous means wavy. Okay, see here, it is tortuous. The tortuosity of the facial artery is important for movement of the facial muscles. Okay, it helps in the movement of the muscles. That's why we will see tortuous facial artery. Okay, you know where it is taking origin from. What is its course in the neck, pores in the face, okay, and it gives off branches. What are the branches? It gives off some submental branches. We will not discuss that because these are the branches coming in the neck region. In the face, it gives three types of branches. One is inferior labial branch. This is the oral cavity. You can see the oral cavity here. Inferior labial artery. Labial refers to the lips, okay. Inferior labial, superior labial, and nasal branches, okay. Nasal branches, or these are also called as alar branches. Alar branches supply to the ala of the nose. Ala means this region, okay. The elevated portion of the nose is called as ala. Ala, A-L-A. Ala means wings, okay. So alar branches. After giving these three branches, facial artery enters till the medial angle of the eye, okay. At the medial angle of the eye, it goes here, and anastomose with what? Anastomose with ophthalmic artery, okay. Ophthalmic artery is the artery supplying, superior ophthalmic artery supplying the orbit. So it goes, it anastomoses, that means fuses with the superior ophthalmic artery. Superior ophthalmic artery is a branch of internal carotid, okay. So here there is a typical point of anastomosis, medial angle of the eye. We have anastomosis of branches of external carotid and branch of internal carotid, okay. External carotid artery branch is facial artery. Internal carotid artery branch is a superior ophthalmic artery, okay. That we will study slowly, don't worry. Right now you have to understand origin, course, termination. Termination, how it is terminating? By anastomosing with superior ophthalmic artery, okay, and branches in the face. So that is the blood supply of the face. Along with facial artery, we have transverse facial artery also. It's a branch of superficial temporal, okay. Superficial temporal is going to the scalp, right? Superficial temporal artery, that gives off one branch which goes transversely on the face, and that is called as transverse facial artery, okay. It again comes from the parotid gland and supplies to the face, okay. So these are the blood vessels supplying the face. Now veins of the face I am not discussing right now, because veins of the face we have done along with veins of the scalp, okay. Veins of the scalp and veins of the face together we had completed. So you have to draw and write a short note question on blood supply. Blood supply includes arterial supply, venous drainage, both, okay. Two important features I am not discussing right now, that is dangerous area of the face, okay. I am not talking right now about the dangerous area of the face and pterygoid venous plexus. We will discuss that bit later, okay. Right now just understand facial veins, how they are draining. Am I clear till here, everyone?
Yes, ma'am.
Yes,
Yes,
ma'am.
ma'am.
Nerve supply of the face, blood supply of the face, everyone clear?
Yes, ma'am. Yes, ma'am.
Any questions? Okay,
No, ma'am.
now just take 2 minutes break. Don't go anywhere, okay. We are going to start with embryology part. We will complete this so that in the next session we will complete of fertilization, okay. Gametogenesis is still pending.